How do you explain a disease in simple terms so your patient can understand? A common struggle registrars encounter is they find it difficult to explain a disease to a patient without using jargons or without having a long-winded explanation. In this tutorial, we're going to cover how you can explain a disease in simple layman terms so your patient can understand. The first tip is to make sure that you brush over your knowledge of the disease so that you can understand it yourself, so that you can explain it to your patient. It is useful to go over on patient.info or NHS website to look at how the disease is explained so you can see what layman term you can use to explain to your patient. Tip number 2 is to get an understanding of what the patient already knows so that you can build on their existing knowledge. So ask the patient, what do they know about a particular disease? Let me give you a working example. Let's say you're going to explain to Mr. Smith about a benign paroxysmal positional vertigo. Before you start your explanation, ask the patient, have you heard of the term vertigo? What do you know about vertigo? Then the patient will tell you whether they know anything about it. If they know, then they'll tell you how much they know. Then when you're going to start your explanation, you can pitch your explanation based on the pre-existing knowledge of your patient. For example, let's say the patient does not know anything about vertigo. So if you're going to explain a vertigo to a patient, then you can tell them the symptoms that you've been experiencing is what we call vertigo. So the reason why you're having this symptom of vertigo is because there's some crystal in the back of your ears, and what happened is likely that these crystals have been dislodged. When these crystals are dislodged, then they're moving around and doing their own things. When you're moving your head in a particular position, what happened is that these crystals move as well, and they give a signal to your brain. When your brain gets a signal by the movement of this crystal in the back of your ears, this is when you get these symptoms of feeling that you're spinning around. The medical term for this disease is benign paroxysmal positional vertigo. If we break it down, what it means is that it's benign, which means that it's not something concerning. Paroxysmal means that it is something that comes and goes. It's not there constant. Positional is because these symptoms are brought by the movement of your head when you're moving. So it is a problem that is positional. And vertigo is the symptom that you're experiencing. And for short, it is also known as BPPV. So this is something that can be treated. The way we treat it is we could either try and replace this crystal back in the position, or we could talk about something that you can do yourself, which is an exercise to get your brain to accustom to these signals so that you don't feel these symptoms of spinning around and vertigo. So this is how you could explain vertigo to a patient and how you would manage it in a very simple way to your patient. Let me give you another working example. You need to explain obstructive sleep apnea to a patient. How are you going to explain this to your patient? So the patient has been feeling tired, sleepy, and has also mentioned that their wife has noticed that they snore a lot and have been making some awkward noises when they're sleeping and sometimes stop breathing for a long period of time. The method you could use to explain obstructive sleep apnea to your patient is by using the existing knowledge that the patient has said to you. For example, that they've been having symptoms of tiredness, the wife has mentioned that they are snoring and there are periods when they stop breathing. So you can use that as building blocks to build on the explanation that you want to give to your patient. So you can say to your patient, having listened to you, I understand that you've been having issues where you're gasping for air when you're sleeping, and there are times when you're not appearing to be breathing from what your wife has reported. What I think you've got is called obstructive sleep apnea. What it means is that while you're sleeping, you're having a hard time to maintain your airway, which makes it very difficult for you to breathe. And this could be due to various factors. As you mentioned, you've put on some weight, so there may be some excess fat around the neck, which is causing pressure to your airway, which affects the breathing. And this is why your sleep is disturbed, and when you wake up in the morning, you don't feel refreshed. So this is how you can explain obstructive sleep apnea to your patient. And then you can go on and explain about what the treatment options are and whether you need to refer the patient for specific sleep study tests. So I hope you found this tutorial useful. Let me know how you explain disease to your patient and what are your steps. If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you'll get some insights. I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestions. Take care, everybody. Bye-bye.